to make sure.
Hello and welcome into this week's edition of AFMC TV. We're glad you're joining us today. Joining us is our friend of the show, Ken Clark with Chenal Family Therapy, and we are discussing the new 988 hotline or helpline number that has gone live in the United States just in the past few weeks. And so, Ken, thanks for joining us.
Honored to be here as always. Loving what you guys are doing.
Thank you. So let's talk about 988. It's new.
Yeah. So we've always had some crisis helplines and stuff around the country. This is a really a national initiative that kind of creates an equivalent to 911, but for mental health emergencies, in particular, suicide prevention and self-harm and things like that. So it's a really big deal in the sense that it actually creates a coordinated net of people who are there and available and willing to care for people who are in bad spots.
And I understand that this has been in the works for quite some time. I think I was reading it came back in 2020. They began talking, and maybe even before then, about creating a helpline like this.
Yeah, and we've seen this all across first responders and things like that we recognize that the need for mental health and emergency mental health is a unique, distinct need within caring for the population. And so people have been knocking this around forever. Therapists like me have been pounding the table for decades on it. But I think it kind of crystallized with the pandemic, and a lot of people were struggling in the pandemic, and that really moved this to fruition. So it's one of those great moments of everybody getting on the same page and doing the right things for people that live in our state and in our country.
Let's talk a little bit about the fact that it's a 3-digit number versus an 800 number. You're liable, I would think, you might get more calls with 3 digits than you would with more.
Absolutely. 911 has become an iconic thing, right? Like it's, in fact, we were just at a concert and one of the singer's songs was literally called 911, right? We expect and hope the same thing with this, that by the time we get a generation down the road, that'll just be a known thing that every 15-year-old or 30-year-old knows that if you're experiencing a mental health crisis or especially thoughts to hurt yourself, that you can pick up and call these 3 digits. And it's not some long phone number you need to remember. It's going to be very easy, and it'll be on the tip of people's tongues and embedded in their subconscious. So we think it's great that they've made it this simple for people to access help.
Let's talk a little bit about the strides that have been made in the mental health arena, mental health, behavioral health, that's always been with us. And as of late, there's been more of a spotlight shown, but it almost seems as if now the tide is a lot more mainstream. It's not as taboo to talk about as I remember growing up. You used to never hear about mental health, or if you did, it was because you were whispering because you didn't want other people around to know you were talking about it.
Well, and there's been a confluence, like a coming together of probably 3 or 4 things. High performance athletes for decades have been using psychologists and therapists and things like that to perform at a higher level. Actors and business people have been using therapists and coaches for years. So we know that in general, as humans, we crave and want input that helps us live better lives. We also have had a rash of issues come to the surface over the last 15, 20 years, anything from mass shootings or self-harm or just the pandemic. So we've had kind of this coming together of both the really positive high view of mental health, that it's becoming more and more acceptable that top performers in life seek out mental health as part of being a top performer. But at the same time, we've had this unavoidable conversation come to the surface with what's going on in our schools and in our families and things like that. So we're really at this unique, probably once in a lifetime discussion about mental health, where both the positive aspects to it and the detriment when you don't have it, they're front and center. So it's really an awesome time for it. What we are seeing is that the shift is moving from mental health is viewed as something that fixes people to mental health is how healthier people stay healthier. And that's a really important shift, right? In the same way that we go to the dentist twice a year to make sure that we get ahead of cavities, and you go to your PCP a couple times a year or once a year to make sure nothing is cropped up and your cholesterol is okay and all that. We really want mental health to be viewed the same way, that a visit or two a year can keep you from needing to ever pick up the phone and dial the hotline or get more intensive treatment. So it's a very exciting time where we're moving from mental health as a way of fixing things to mental wellness as a way of living a better life for everybody.
I'm curious, from where you sit, do you see that stigma being erased, centered around mental health?
So we see it being erased around certain things. There's certain aspects of the field and certain populations that get treatment that are more or less stigmatized still, and we'll see some change there. We know at this point that kids suffer with behavioral issues, and now it's kind of become the norm. Everybody knows somebody with ADD or something like that, right? So for kids, it's become, I think, a lot safer to talk about. Within the teen population, it's almost uncool to not have a therapist at some point, right? So within those populations, we see it. We know that women in general are the largest group of people that reach out and ask for mental health help. So the place that we're still seeing some stigma that we really need to go after is men, especially men in rural communities and places like that, as well as some of our minority populations within the state. So some groups are all about it. Other groups are still struggling. And that's where we really need men who are business owners and the BIPOC population and minorities to speak up and talk about their own mental health journey, to normalize it and show people that the strong leaders that you look up to also rely on mental health themselves. It's certainly nothing to be embarrassed about, that's for sure. No, and I think we kind of tongue-in-cheek say if there's anything to be embarrassed about, it's not asking for help. It's so available and easy to get, and we're even our field is evolving in the quality of treatment so fast. It's the low-hanging, easy fruit. It's like taking your vitamins every day. Everybody should be leaning into mental health for a better life. Ken, anything else you'd like to add? Well, I would just tell you, don't be afraid to pick up the phone and call that hotline. That's why they're there. There's no call that is problematic for them. They will direct you to the proper resources. Spread the word about it. Post on your social media about it. We will lose less of our friends and family to suicide or severe mental illness if we all take part in getting the word out about this hotline. So for everybody listening at home or sitting in a waiting room right now, please, please, please spread the word about this hotline. Awesome. Ken, thank you so much for joining us. Honored to be here. Joining me now is Dr. Mary Chatelain from Pinnacle Hearing. And Dr. Mary, thank you, first of all, for coming in.
Yes, thanks for having me.
So we wanted to talk today about the correlation between hearing loss and fall risks. So my first question is there a correlation between hearing loss and falling?
Yes, there is. So most people don't realize that the inner ear, it not only controls hearing, but it also controls balance. So as we age, both of those systems are going to be impacted, your hearing and your balance. It's really interesting because when someone goes from normal hearing to mild hearing loss, which is about a 25 decibel difference, they are 3 times more likely to have a fall.
Oh, wow. 3 times more likely, just by losing a little bit of hearing.
Yes, yes. So it's really important to have that baseline audio to get your hearing checked to determine, okay, do I have a hearing loss? Even if you don't really think there's an issue and other people are saying, hey, I feel like I'm having to repeat myself a lot, not just for hearing, but also for your balance, it's important to have that check done.
And so that check, I guess, is just another way to mitigate that risk because nobody wants to fall.
Yes. And so definitely having your hearing and your vision checked is really important. And also treating those issues. If there is a hearing loss, if there is a vision impairment, not only do you want to get it checked and see exactly what the diagnosis is, but you also want to seek treatment. So whether that is glasses, whether that's hearing aids, you want to have that treatment. That is one way to prevent falls. So the second thing is going to be exercise. So balance and also just building your core strength. Whenever you are about to fall and you have those muscles built up, you are going to be more likely to control your body and not fall. So also just the balance training with yoga, different water activities, you can do that, but also the strength training and getting your steps in. Our bodies were made to move. We're supposed to get around 10,000 steps a day. So the more that you move, the better you're going to do in environments where you might get off balance. And the other thing is going to be to modify your environment. So small dogs, big dogs are a big cause of falls in our patients. Also, grandparents visiting their grandkids and there's toys on the floor. You want to make sure that you really minimize the trip hazards in your environment. Also, the patients are most likely to fall in the bathroom. That's where a lot of falls happen.
And is it because it's so slippery?
Yes, and just you're wet, you may be bending over, putting a towel on, but most falls happen in the bathroom. Also, you think of bathtubs and standing up, sitting down, that's also going to throw you off balance sometimes. So in those environments like the bathroom, making sure you have appropriate rugs, handles, bars, anything that you need as you age, those things are going to prevent you from falling.
Okay. So if we notice or have someone in our life and maybe they are a little off balance or have fallen and didn't make the connection, I wonder if this has anything to do with hearing. How often should we be getting our hearing checked and to prevent a problem?
So we definitely recommend if you're over the age of 50, get your baseline audio. Even and that's an audiogram, that's a hearing test. Even if you feel like there's not a hearing issue, get that done. Now, once there is hearing loss is established, we recommend that if treatment is recommended, you move forward with treatment. After we diagnose a hearing loss, depending on if there are any additional issues coming up, we could be doing a hearing test every year. It could be every 2 to 3 years. But once you get your hearing tested, and you have a hearing loss, you shouldn't say, I got that done 10 years ago, I'm good. We're going to do it consistently. So, I just really caution when it comes to falls, 84% of patients, once they fall, that is like a downward spiral of, that's when assisted living starts, nursing homes. That's when you lose your independence, because falls can, in the geriatric population, can cause seriously bodily harm. It's not always something that is life-threatening, but typically when there's a fall and you're looking at paralysis happening, you're looking at a hip replacement, a head injury, that is when you're going to have additional health issues. That's when you start to lose independence. That's when things can go downhill really quick. A hearing evaluation is something really easy. Hearing aid treatment, that is a really easy thing to do. Getting your vision checked. These normal things we kind of take for granted. It's so important to do those things to prevent major issues as you age.
And that's all something that I know I would never think of, that just by getting those simple things, hearing checked, vision checked, that's your pre-maintenance, to keep you from really potentially getting into a lot of trouble later on down the road.
Yes. And one really cool thing about our newer hearing aid technology is it has what we call fall risk detection. Okay. So it's basically a fall detection. So if you do fall and you've got your hearing aids in, there's actually an alert that is in the hearing aids that can send a GPS signal to your family members.
Fantastic.
So that way, if something happens, your family's aware. It's an immediate notification, like a SOS.
Yep.
And that is something that can really help our independent parents that are still living on their own that maybe aren't in assisted living.
And every second counts. Time is always of the essence. So the adult child gets that alert, they can call 911 and get things happening much faster.
Definitely. And I told you earlier, your fall risk is going to increase once you go from a normal to mild hearing. It increases 3 times. So for every 10 dB additional hearing loss you have past the mild hearing loss, your risk is going to increase even more. Okay. So it's really important to seek treatment, do something about it. This is something in control. And who wants to wear hearing aids? Most people don't. They're concerned about how they look. But I mean, who wants to have surgery? Who wants to be in a wheelchair? Who wants to not have the ability to take care of themselves? This is an easy thing that can be corrected.
Fantastic. Okay, Dr. Mary Chatelain, thank you so much for coming in today and letting us know.
Awesome. Thanks for having me.
And thank you so much for joining us. We'll see you back here next week for more AFMC TV.